Hi, I'm Art Kaplan. I'm at the NYU School of Medicine, where I head the Division of Medical Ethics. Well, currently, one of the most famous patients of all time has now been identified publicly as having COVID. Joe Biden's doctors announced that he had contracted the disease. I don't think this is a surprise to anyone. We see so many people coming down with it. We see so many people being reported in this country and elsewhere as having caught this new variant that's highly contagious, that I think it was only a matter of time, probably until he got sick. Joe Biden is probably the most famous patient in recent times to get COVID. And we're all watching closely to see what's going on. But he is setting an example, a role model, teaching lessons just by getting this disease. We all know that he's been traveling around to many places overseas and around the US, and he didn't mask. And I think he should have been masked. It sent a message that perhaps that wasn't important. I think that we can watch carefully and see what kind of care he gets. And the problem will be many Americans don't have access to the kind of care he's going to get through COVID. And perhaps we need to worry about what the long-term impact of this disease might be on a 79-year-old man. His doctors say he only has a mild case. His doctors say he's doing pretty well. And that makes sense. But let's remember, Joe Biden is 79 years old. Some people say they see signs of frailty in his gait and speech. So there is reason to be concerned because he's absolutely in a high risk group. So, what does him getting COVID mean for our attempt to contain the COVID pandemic? What's likely to be on the minds of patients as they see the president go through this experience? And what's the impact likely to be down the road for doctor patient communication about COVID? So, for one thing, you have to remember President Biden did not aggressively take steps to try and protect himself. And what I mean by that is, while he was tested frequently for COVID, as was Donald Trump in the pre vaccine days, he did not mask all the time. He definitely was in groups of people around the world where he wasn't wearing a mask. He did not distance all the time from people. Some of you remember the recent picture of him giving a fist bump to the leadership in Saudi Arabia, but no mask and obviously close contact. And as far as I know, his staff wasn't taking precautions to make sure that it was in well ventilated spaces or outdoors whenever possible. That has an impact. People see what's going on with the president, and some are absolutely going to say, if we're all going to get it, then whether the rates are going up and up and up, Los Angeles County indicating it might go to mask requirements soon. I don't think people are going to do it. If the president doesn't do it, if he's not the role model, and it looks like we have this attitude that it's inevitable that we're going to catch it, that's really going to make it very, very difficult to do things in the prevention realm. I'll predict that if he comes through this okay, it's really going to be difficult no matter what the virus is doing to get us to put our masks back on. I just don't think the public has the will to do it anymore, rightly or wrongly. And when our leaders all catch COVID and when they pull through, people start to think, no point. Biden also has access to excellent health care. And he has had his 4 shots, 2 boosters, if you will. And he certainly had primary care and was getting tested almost daily, apparently. But a lot of Americans don't have that. They don't have good primary care. Some don't have testing. I have a neighbor up here in Connecticut, where I'm speaking to you today, who went to a test and treat center, had symptoms, wanted to make sure that he got the antiviral drug Paxlovid, which the president is on, and he was turned away because they didn't take his insurance. We still have not paved the way for our patients to access easily, quickly COVID testing and good advice, as well as access to antiviral treatments. So I think there are still roadblocks out there. The president's care should remind us that there's work to do to make sure that every American can succeed in getting the kind of care that the president is getting. It's also the case, just as a public policy matter, that while his doctors say his case is mild, it could deteriorate. Let's hope not. But we've seen many, many problems in the past with Donald Trump and other presidents where there's been kind of a reluctance to get in discussions about shifting authority, shifting the presidency to somebody else. President's doctors don't want to do that. President's staff doesn't want to do that. They're loyal. They want him to, kind of retain the power of the presidency. But let's say he does get very sick. Will we trigger the 25th Amendment? Who will be talking about that? Can we get transparency there? Remember, too, there's one other big risk out here that Joe Biden faces, which I hope doesn't occur, and that's long-term COVID. In the short run, he can isolate. In the short run, he can probably do his job, staying safe and distance from others. By the way, he can quarantine, or he can isolate in a way that many Americans can't. I think how his COVID is managed has big lessons that the nation is going to be paying close attention to. Some of them, I worry, may make us more vulnerable to COVID spreading even faster, a president who didn't mask. Other people may look at him and say, if a 79-year-old can get through this, then I'm not going to worry too much about COVID anymore. To heck with vaccination, to heck with distancing, to heck with staying home. If an older high-risk person can survive well, then I'm not going to worry about it much either. And all of us need to be watching closely and expecting full transparency should this virus wind up impairing our president in the long run. I'm Art Kaplan at the Division of Medical Ethics at NYU School of Medicine. Thanks for watching.